Hello, my friends. I'm Dr. Valeria Mendoza, a urologist and men's health specialist with more than 12 years of experience helping men protect not only their bodies, but also their confidence, dignity, and relationships. In my clinic and in conversations like this one, I've seen how the right knowledge can turn awkward silence into clarity and worry into connection. Today, we're going to have one of the most open, honest, and yes, slightly blush-worthy conversations you'll find on the internet. It's the kind of question many men whisper in private, search online for late at night, or ask in my office with their eyes lowered, unsure how to begin. Here, though, we do things differently. This is a safe, respectful space, a place where we discuss intimacy, vitality, and men's health without shame or judgment. Because the moment we bring sensitive questions into the light, we don't just learn, we heal, we connect, and we realize we're not alone. Gentlemen, let me ask you directly. Have you ever quietly wondered, is it safe to swallow vaginal fluids during oral intimacy? And what about taste or smell? Are they normal? What do they mean? Is something wrong? These are real questions that can influence self-confidence, closeness, and whether intimacy feels joyful or awkward. The truth is, most men haven't been taught the actual science behind these concerns. So today, I'm going to walk you through the complete answer, medically, biologically, and emotionally, so you and your partner can enjoy intimacy without fear, without shame, and with deeper trust. Before we dive in, do me a quick favor. Tell me in the comments where you're watching from today. I love seeing men from around the world learning together. And while you're here, tap like and subscribe so you never miss practical, life-changing advice on men's health, intimacy, and vitality. First principles. What vaginal fluids actually are. Here's the first thing I want you to know. Vaginal fluids are not dirty, toxic, or shameful. In healthy couples, they're generally safe. In fact, they are purpose-built by the female body to protect delicate tissues, reduce friction, support a healthy microbiome, and make intimacy more comfortable and pleasurable. When we understand that design, we stop treating the body's wisdom as a taboo and start recognizing it as brilliance at work. Still, many men carry quiet fears. What if it's unsafe? What if the taste is strange? What if something's wrong with my partner? The truth is simple. Variation is normal, safety is achievable, and communication is the bridge between uncertainty and confidence. As a urologist who has worked with men for over a decade, I've seen how unspoken worries can slowly wear down confidence, connection, and even a man's sense of masculinity. I've counseled men in their 40s rediscovering intimacy after divorce, men in their 60s and 70s finding love again, and long-term couples trying to rekindle passion after years together. And there's a pattern I see again and again. When men finally understand how vaginal fluids work, what's typical and what's not, and how to approach the topic with care and respect, shame dissolves, and intimacy deepens. The 5 common mistakes, and what to do instead. Mistake number 5, believing vaginal fluids are just moisture. They're not. Vaginal lubrication is a masterpiece of biology. The Bartholin's glands release a silky fluid that reduces friction and protects tissues. The Skene's glands, near the urethra, can contribute additional lubrication and, in some women, female ejaculation. The cervix produces mucus with changing texture and volume across the cycle, and some contribution persists even beyond peak fertility years. This isn't random. It's a coordinated system designed to prepare the body for safe, comfortable intimacy. Ignoring this is like overlooking the entire point of nature's design. Mistake number 4. Assuming taste or smell automatically means something is wrong. Here's the nuance. Fluids naturally vary. Diet, hydration, stress, hormones, and medications all shape taste and scent. Hydration, pineapple, berries. Often lighter, fresher notes. Garlic, coffee, alcohol can give a stronger edge. Around ovulation. Typically more abundant, often neutral. Around menstruation. A slight metallic note can appear. After menopause, sometimes less plentiful and slightly more acidic. None of this is bad, it's individuality. The time to pay attention is when there's a sudden, unpleasant change accompanied by itching, discomfort, burning, or unusual discharge. That often signals a simple imbalance that's easily treatable with appropriate care. Responding with curiosity and support, not judgment, keeps intimacy safe and emotionally secure. Mistake number 3. Forgetting that health status matters. While vaginal fluids consist largely of water, amino acids, enzymes, glucose and lactic acid, and have protective features, they can, like semen or blood, carry infections such as chlamydia, gonorrhea, herpes, or HIV. The mistake is assuming it's always safe. The reality is that safety depends on both partners' health status. That's why conversations about testing aren't unromantic. They're the foundation of trust. When you know where you both stand medically, worry drops and closeness grows. Mistake number 2. Avoiding the testing talk. Many men hesitate to ask, "Have you been tested?" Or, "Should we go together?" I once saw a patient in his 60s who panicked after intimacy because he had bleeding gums and feared HIV exposure. The risk from oral intimacy is low, but not zero. He and his partner got tested together. Both were negative, and the process brought them closer, more transparent, more connected. The lesson: safety doesn't kill romance. Safety strengthens romance. Mistake number 1. Responding with shame instead of acceptance. This is the most damaging mistake. If fluids taste stronger or smell different, some men recoil, joke, or criticize. That shuts down arousal and trust almost instantly. A far better approach? Kindness and collaboration. Suggest a refreshing shower together, encourage hydration, or make gentle, respectful adjustments as a team. When a woman feels fully accepted, her arousal deepens, her trust expands, and intimacy becomes more powerful for both of you. Turning knowledge into practice. Here's how to make intimacy both safe and deeply rewarding. Talk openly and early. Normalize short, caring conversations about fluids, taste, comfort, and health. A quick, calm check-in before intimacy can prevent misunderstandings and make both partners feel seen and safe. Test together, twice a year. Consider routine STI testing as part of your health ritual. Just like dental cleanings or annual checkups, doing it together replaces anxiety with certainty, a powerful aphrodisiac for the mind. Care for hygiene and hydration. Drink water, support a balanced diet, and when you can, shower before intimacy. These simple habits can positively influence comfort, scent, and taste, and they send a message of mutual care. Lead with compassion. Treat changes as something you navigate as a couple, not as a flaw in your partner. Curiosity and respect say, "I'm with you," and that tone turns a potentially awkward moment into connection. Celebrate acceptance. For many women, feeling fully accepted, body, cycle, and all, is profoundly bonding. If both partners are healthy and infection-free, swallowing vaginal fluids is generally safe, and for some couples, it can feel like a deeply affirming gesture of trust. Reassurance for every stage of life. Gentlemen, listen carefully. You are not too old for intimacy. Passion doesn't retire. Trust doesn't expire. With age, the opportunities for patience, presence, and depth actually grow. If you've carried quiet fears about this topic, allow them to lift. If you felt embarrassed to ask, know that thousands of men have the exact same questions. You are not strange. You are not alone. Approach intimacy with wisdom, respect, and acceptance, and you don't just protect health, you nurture connection. That's what makes intimacy joyful at every age. So, to answer the core questions clearly, is it safe to swallow vaginal fluids for healthy, infection-free couples? Yes. Is variation in taste and scent normal? Absolutely. What's the real secret to confident intimacy? Communication, trust, and compassion. If this conversation helped you, give the video a like so more men can find it, and subscribe. I share new men's health advice every week. And don't forget, tell me in the comments where you're watching from. I read them and it helps this community grow. I'm Dr. Valeria Mendoza, reminding you, your health fuels your confidence strengthens your connection, and passion has no expiration date. Take care, my friends, and I'll see you in the next video.